Hello everyone, my name is Nadia Jones. I am a nursing student at Indiana State University's LPN to BSN program. This health education program is for N444 community health. Lead poisoning, an obligation to prevent it. Before we get started, please take a moment to pause this video and access the pre-test link featured in the video description below. Learning objectives. By the end of this presentation, all participants will be able to define lead poisoning, identify the population at risk for lead poisoning, describe known sources for lead exposure, report the symptoms of lead poisoning, identify the treatment options for lead poisoning, and explain prevention strategies. After completion of this course, all participants should be able to pass the post-test. What is lead, and what levels are considered toxic? According to the World Health Organization, lead is a naturally occurring toxic element found within the Earth's crust. Environmental contamination and human exposure to any amount of lead can have a toxic multi-system response. When lead enters the body, it travels to the brain, liver, kidneys, and bones, and then is stored in the teeth and bones. Lead can also spread to developing fetuses via blood during pregnancy. According to Yale Medicine, lead is most dangerous when it is inhaled or swallowed. Once lead enters the bloodstream, anemia and calcium malabsorption can occur. To determine the severity of lead poisoning, medical professionals check serum blood levels. What are the known sources for lead exposure? Lead can be found throughout the environment. Older homes built before 1978 and those constructed in impoverished areas often contain lead-based paint. Problems arise when the paint peels or cracks because lead dust can be inhaled or swallowed. Lead can be found in water pipes, faucets, and plumbing fixtures, so contamination of drinking water can be a problem. Pipes that carry drinking water from a water source to the home may also contain lead. The 1986 and 1996 amendments to the Safe Drinking Water Act, along with the lead and copper pipe rule by the EPA, set the maximum contaminant level goal of lead at 0. But that doesn't mean that contamination of drinking water does not occur. Lead has been found in some toys, jewelry, traditional home remedies, and international imported candy. For example, a supplement called DHZC2 was linked to cluster lead poisoning cases in 2016. According to the World Health Organization, traditional medicines in India, Mexico, and Vietnam often contain high levels of lead. Airplanes can also put lead in the air and soil from aviation gas. Lead particles can be inhaled during the burning of lead-containing materials, such as during recycling, stripping of leaded paint, or the use of leaded gasoline or leaded aviation fuel. Lead can be ingested from food cooked in lead-glazed containers. Which populations are the most at risk for lead exposure? According to the World Health Organization, very young children, including fetuses and undernourished children, are at the greatest risk for lead poisoning. According to the Center for Disease Control, children who live in homes built before 1978 and those who live below the poverty level are the most at risk for lead poisoning. Young children, meaning those under 6 years of age, are the most at risk for lead poisoning because their bodies are not fully developed yet and because they are more prone to putting contaminated objects or dirty hands in their mouths. Housing inequality increases the risk of lead exposure. People who do not have access to safe, affordable housing or struggle to find a healthy, safe place to live due to discrimination are at increased risk. According to Yale Medicine, although low-income housing is a risk factor, middle and upper-class families who live in historic homes are also at risk because stained glass, built-in hutches, and white picket fences often contain lead. What are the symptoms of lead poisoning? According to Yale Medicine, lead poisoning in children between the ages of 1 and 5 is defined as serum lead levels of 5 micrograms per deciliter or more. Testing is often performed via finger prick. Symptoms of lead poisoning vary from person to person. According to the FDA, lead poisoning affects almost every system in the body, produces no obvious symptoms, frequently goes undetected, and as a result, all children should be screened for lead exposure. Patients with low serum levels may be asymptomatic, whereas those with higher levels may present with abdominal pain, anemia, or behavior and learning problems. Autism often presents between ages of 1 and 2. Emotional difficulties can arise for families of young children with lead poisoning who are placed on the autistic spectrum. How is lead poisoning treated? There is no cure for lead poisoning. According to Yale Medicine, the best treatment for lead poisoning is to remove the source of contamination. Even without a cure, the effects of lead poisoning can be reduced by participating in learning, nutritional, and/or behavioral programs as soon as possible. An iron and calcium-rich diet also helps because lead competes with them in the body. For blood serum levels under 5, routine assessment or nutritional and developmental milestones, anticipatory guidance about common sources of lead exposure, and follow-up blood tests are recommended. For blood levels between 5 and 19, routine assessment, environmental exposure history, follow-up blood lead monitoring, and nutritional counseling is recommended. For blood levels between 20 to 44, a complete medical history and physical exam with neurodevelopmental assessment, an environmental investigation of the home, follow-up blood lead monitoring, lab work, including iron status, hemoglobin, and hematocrit, and abdominal x-rays with bowel decontamination are recommended. For blood levels between 45 to 69, complete history and physical with neurodevelopmental and complete neurological exam, environmental investigation of the home, follow-up blood lead monitoring, lab work including iron status, hemoglobin and hematocrit, abdominal x-rays with bowel decontamination, oral chelation therapy, and possible hospitalization are recommended. For all blood levels above 70, hospitalization and chelation therapy in conjunction with a medical toxicologist, environmental investigation and lead reduction, follow-up of blood lead monitoring, lab work including iron status, hemoglobin, and hematocrit, and abdominal x-rays with bowel decontamination are recommended. How can lead poisoning be prevented? If you have a lead service water line, use a filter for all water used for drinking and cooking. According to Children's Healthcare of Atlanta, 90% of lead poisonings occur at home. Check www.recalls.gov for recommendations to eliminate any products that may contain lead in your home. Also, wash toys and pacifiers to reduce the risk of lead dust contamination. Test homes built before 1978 for lead-based paint and remove any peeling paint. If you would like to know more about this topic, please check out the references listed below. Thank you. Now please take a moment to pause this video again to access the post-test and brochure in the description below.